So alpha-mannosidosis, for those who aren't familiar with it, as many people aren't, is a lysosomal storage disorder caused by having two pathogenic alterations in the man2b1 gene that leads to a deficiency of an enzyme called alpha-mannosidase. And that enzyme works within our lysosomes to help degrade products and recycle them in our cells. And when that enzyme isn't working, then we have accumulation of substrate, which can be toxic, of course, to the lysosome, but then also overall to the cell itself. These cells obviously are all over our bodies. So this disorder, like other lysosomal storage disorders, is multisystemic. It affects many different body systems and it can be progressive. This condition as well, alpha-mannosidosis, has a lot of variability. So there is a spectrum of involvement with alpha-mannosidosis and the patients affected by this condition. So being aware of some of the more subtle features and some of the more characteristic features can be very important for healthcare providers and families alike. So I think one of the main things to consider with alpha-mannosidosis when you're looking for symptoms or possible presentation is the fact that there is a lot of overlap with other lysosomal storage disorders. So there are characteristic features that kind of clump together a lot of these disorders and diagnoses. And some of those include things like coarse facial features, skeletal abnormalities. For alpha-mannosidosis particularly, we have concern for early hearing loss that's mixed in nature. So we see both conductive and sensory neural portions of hearing loss for these patients. In addition to, we have frequent infections. So these patients can be sick really frequently, very early on. They can have enlarged livers and spleen or hepatosplenomegaly, in addition to developmental delays, intellectual disability, and also difficulties with movement and walking.